Rural access to mental health services as a topic of my research implores the question of what are the various issues facing access to mental health care in rural settings, and what interventions can be done to tackle these. In this video, I hope to share with you some of the current barriers facing rural access to mental health care in these communities and the proposed solution to overcoming these barriers. Access to mental health care is significantly hindered in the rural United States. Approximately 97% of land area in the United States is classified as being rural, and it's home to about 60 million people, which is roughly 1/5 of the population. A pressing issue for a significant portion of our country, unequal access to mental health care in rural areas is definitely something to investigate and worthwhile in finding solutions to combat it. There are numerous reasons as to why rural patients have difficulty accessing mental health care, but they are largely defined under 3 categories. These include practical barriers, which are any physical issue with accessing mental health services. These include location of providers, cost of the care, lack of insurance for services. Practical barriers may be the first thing that comes to mind when you think of issues concerning access, but they're just one of many. There's also personal belief barriers. Personal belief barriers are issues surrounding the personal beliefs of patients. They may mistrust their provider or mistrust the healthcare system in general. These issues tend to surround a much deeper level and lead us into our next and last form of barrier, which is stigma barriers. Stigma barriers are any barrier that deals with the surrounding stigma that comes with accessing mental health services in rural areas. In comparison to personal belief barriers, they are typically larger scale issues that affect the community. These include but are not limited to embarrassment and discrimination. There is hope though. There are things that can be done to increase access to mental health care in rural areas. The first being digital mental health interventions, also known as DHMIs. One proposed solution to creating equal access to mental health care is the institution of telemedicine into rural communities. This tool was highlighted by the COVID-19 pandemic, when communities tended to be at much higher levels of stress. Telehealth aided in closing the gap between patients and their providers and has become a more accepted form of practice. This tool eliminates some practical barriers facing rural areas, but fails to consider that many rural patients do not have access to a stable network connection, much less technology at all. There's also policy as a proposed solution. In addition to telehealth, there is an increased interest in implementing policies to further expand coverage to patients in rural areas. The Department of Veteran Affairs, in fact, worked to expand coverage outside of urban areas to rural patients regardless of their military status. It was discovered that with each policy change, there was a statistically significant difference in mental health care being accessed in rural areas. If the care is offered, it will be accessed. That is to say, though, that policies on mental health do not always benefit rural communities. One policy, the Medicare Mental Health Provider Policy, created a gap in care as it led to a significant decrease in master's level mental health care workers available to Medicare patients. This was particularly burdensome on rural areas as they already faced issues with access to mental health care, and providers insured under Medicare decreased. The last proposed solution is integrating mental health care into primary care. Another possible way of increasing access to mental health care is by continuing to implement it into primary care practices. Primary care providers are often able to provide medications for mental disorders, and it is becoming more accepted to integrate mental health as a component of a patient's overall well-being. Overspecialization is a pressing issue, and it drives up the cost of healthcare a whole bunch. Instead of seeing a psychologist who specializes in a specific mental health disorder, under this model, you could see your primary care provider while insured for a much lower cost. This tackles not only a practical barrier of cost, but also personal belief barriers and stigma barriers, such as patients are much more likely to have faith in their primary care providers and trust in their methods. In conclusion, the issue of unequal access to mental health care in rural areas is one that needs to be combated and prioritized in doing so. The practical, personal belief, and stigma barriers have the capability to be eradicated through digital mental health interventions, policy, and by integrating mental health care into primary care. With more focus put into these rural communities that are often neglected by the larger healthcare structures, equal access to mental health services can be accessed for all Americans. Thank you for watching.